As an OBGYN, I remember being very concerned about my fertility. I was 34, I wasn't pregnant yet, and I had just been married for a few years. And also, I was just starting my private practice, so I was very, very busy. But if a gynecologist can worry about her fertility, certainly I know how much my patients worry about. Can I have a baby? Am I getting too old? What do I need to do to have an optimal pregnancy and actually be able to conceive? So this is a big concern as we delay our pregnancies, because really our most fertile times are in our 20s. But that doesn't suit us as women. As women, we're working and we're busy, and a lot of times, like me, we delay our pregnancies. So when women come and say, I want to know if I can get pregnant, the first thing I do is I measure her hormones. I measure her thyroid, because when thyroid is low, you're more likely to miscarry. And if you're 37 trying to have a baby, you don't want to miscarry. I mean, you want to have every pregnancy count. Low thyroid increases miscarriages dramatically. And this is a very subtle analysis that I do to see, is your thyroid just a little bit low? Is it very low? Is it okay? You want to have perfect thyroid when you want to conceive. The second thing I check is I check something called an anti-Müllerian hormone. That's the AMA. And it's a very accurate assessment of how many eggs we have left in our ovaries. So a high number is very encouraging. And if women are getting a little bit older and I tell them your AMA is fantastic, they relax, and frequently just by relaxing and not being anxious, they can get pregnant faster. So what is this thing about anxiety decreasing fertility? Well, our adrenal glands are very important in terms of conception. Our adrenal glands are two little glands that sit back on our kidneys, and they create critical hormones that beat our heart, maintain our emotions in a happy state, help us to maintain healthy bones and really a good body composition. And there are stress hormones. So when we're stressed, those hormones can go way, way up. And that puts a stress on the body, and fertility is less. It's been proven that when women are in self-help groups with other women, fertility, I would say counseling groups once a week with a fertility specialist, and they're all talking about their worries and their concerns, and then the doctor is able to respond to their questions. Fertility and conception, successful fertility and conception is 40 times better. And that has to do with women being less stressed. They feel more supported. They realize that lots of women who are 38 or 39 have babies, or 36, or whatever age you're at. So diet is very important. Prepare for your pregnancy. Get off of alcohol, which is toxic to the body, even though I have a glass of wine now and then. Please don't make it a regular part of your life if you want to conceive. Also, decrease sugar. Just get it out of your diet. Sugar coats the cells, and the cells that are coated with sugar cause much more cellular dysfunction. And you don't want cellular dysfunction, badly functioning cells when you're going to be pregnant. So eat lots of greens, eat lots of fiber, avoid sugar. Sleep is so important in terms of conception. I tell my patients who want to conceive to sleep 8 or 9 hours a day. It's just like the whole body relaxes, and you add meditation to that amount of sleep, and pregnancy rates go way up. I mean, the benefits of meditation for pregnancy and for being a good mother are amazing. So please try to find some kind of relaxation, yoga, meditation, or Tai Chi, some type of a spiritual practice or a physical practice that can relax you and decrease your stress. What can you do aside from sleeping and balancing your hormones? Well, there's pregnancy prep, which is a wonderful set of herbs by the company Vitanica. So it's a naturopathic solution to help prepare yourself for pregnancy. I mean, I have women get pregnant very rapidly when they're on pregnancy prep, and I have nothing to do with that company. It just seems to work quite well for women. The second thing is to help your thyroid stay healthy. You can eat 3 or 4 Brazil nuts a day, which has 200 micrograms of selenium. And selenium is very important in terms of maintaining thyroid health. You can also take iodine, and there are a couple of different sources of it. One is iodoral, which you can get on Amazon or online. And the second one is Crow's Lugol's, Lugols iodine. you do about 3 to 4 drops a day. So that is a way to naturally maintain your thyroid health and boost your thyroid production of the hormone, which is very important in pregnancy. So sleep, diet, meditation, and good practices, those supplements, I know you're going to have a healthy baby. And if you try for more than a year and you're not getting pregnant, by all means, see an infertility specialist or a fertility specialist, because there's so many things that can be done on a more sophisticated level. And my patients have been so very fortunate and happy to be able to achieve success in having the amount of babies that they want. And I know you will too.